Good afternoon, everyone. Welcome back to Let's Talk Wednesday. My name is Melshani Collins, and I am the CEO and family advocate of the G.R.A.C.E Agency, where we advocate for families that have child welfare cases. We also help fathers to gain rights to their children through legitimation, and we help to connect families through local community resources. So, the more of the services that we offer as well is that we don't just do legitimation, but we also do different court petitions, right? So we do contempt, we do paternity, we do modification of child support, and we also do modification of custody and visitation as well. And then we also do third party custody petitions. And that is if another relative or grandparent is trying to get custody of a child that has been left with them and the parents are nowhere to be found, or there's an emergency situation as to why that person is requesting custody of that child. So if you are in need of any of those services, or you need help with, just finding out what type of petitions you need to fill out so that you can go to court for whatever your issue is, definitely contact us at 678-729-7261. We do free consultations where we're able to discuss with you what your issue might be, and then we can help you from there. And if our agency isn't able to serve you, then we will find another service provider or organization that can serve you. Okay. So again, also our website is www.grace-ga.com. You'll go on our website, you'll see the services that we have to offer. You'll also see more information on how to contact us. And also, if you want to book a consultation, there will be some buttons on there that will say book a free consultation. So you can also hit that button as well, and the consultation information comes straight to my phone, and I definitely will give you a call within 24 to 48 hours. So you all, again, that is the G.R.A.C.E Agency, and I am the CEO and family advocate of that. But we're going to move on to our Let's Talk Wednesday. And I get excited every week because every week, you all, we feature somebody different, somebody new, right? A different organization or agency that is able to bring you their resources and services that they have to offer. What other place is doing that, right? If we can't get the community to come out to us, guess what? We're going to come out to the community, okay? So what we're doing is every single Wednesday, we feature somebody different, because I realize that there are so many different providers out there that have different services. But if you don't know that they're out there, you don't know that they're local to you, you can't utilize their services. And so what I do is I partner and I network at different events that I go to, just so I'm like, you know what, this seems like this would be a good services that the family and the community, that's what I call y'all family, that they would be able to use. And so I just contact them, and they are always more than welcome to talk to you all about the services that they have to offer. If y'all are not logged in, if y'all are not plugged in on Wednesdays, and I do it between 12 and 1, y'all are missing out, because I get so many different people that contact me. Hey, Miss Collins, I missed your live, or hey, Miss Collins, I need this service. And I'm like, you need to go and watch your live. That's where all the information is, okay? So you all, I'm so excited. We are going to talk to a different organization today, and that organization is called the Fulton-DeKalb Hospital Authority. And we are going to talk to Mr. Jalen Husband, and he's going to give us all the information, all the details on what they do at their agency. So I am going to join him in on the stage, and then we're going to go ahead and get started. Hey, Jalen, how
Hey,
are you?
doing good. How you doing?
I am great. I am
Yes.
great. Well, first of all, thank you so much for taking time out of your day
Yes.
to join us on Let's Talk Wednesday, because we've been trying to get together for a minute.
Yes, we have.
So I'm so excited. Thank you again, Jalen.
No problem.
All right. So what I'm going to let you do is just introduce yourself, who you are, and what you do at the Fulton-DeKalb Hospital Authority.
Okay. So my name is Jalen Husband. So I'm the CHW Chronic Disease Coordinator for the Fulton DeKalb Hospital Authorities, owners of the Grady Health System. So within my role, I primarily help manage our different initiatives that we have, which is the Community Health Worker Initiative, also our Men's Health Division, and also our faith-based organization initiatives that we have here.
Okay,
Mhm.
awesome. So tell the community, what is a community health worker? What do they do?
Okay, so community health workers are those frontline individuals that know the community. So they are in the community at different locations, so they provide different resources and services. So, for example, if someone needs help, for example, with rental assistance, a community health worker will be able to provide their resource. Or someone needs health information on how to, access different services in the community, a community health worker is there. So, if someone needs to know more information on, diabetes or hypertension, usually a community health worker is educated in those different areas, and they can provide, get some guidance, to a certain degree on how to manage those different conditions that patients may have. And they also they can help them through different situations. So if
Mm-hmm.
someone having a crisis or something like that, again, to a certain degree, community health worker can step in, and they can offer resources to guide that person in the right direction, so they're not lost on the endless loop of trying to find this and that and that and this. They
Mm-hmm.
can help streamline them to the right service that they may need.
Okay, okay,
Mhm.
awesome. So specifically, what services does the community health worker help to get to the community? Because I see that you all
Mhm.
have services that y'all help with health needs, social needs, educational needs, mental health, and vocational needs. So what specific programs do you all introduce or resources under that?
Okay, so particularly how it starts is a community health worker, or our community health workers are at different locations, and they do assessments on patients depending on what that patient may need. And from there, their community health worker will provide the different resources. So if it's a mental health resource or a health, we'll refer them to different agencies, for those resources. So we're not a direct service organization, so we don't directly provide those resources. We
Okay.
just provide the resources that fit the individual and their situation.
Okay, perfect. And do you only service clients that are in Fulton and DeKalb?
Yes, primarily Fulton-DeKalb County. Those are our targeted areas because we own the Grady Health Systems, and that's Grady is in Fulton County. So we got to make sure we stay within those two service areas to provide our services. And also, I was going to say we also provide health education. So our community health workers, they go out to the community, such as senior facilities, and provide education on
Okay.
how to manage medications, how to age healthy. They also go to food banks as well, provide education and do referrals. So they're all in the metro area, out in both of those counties, to provide those services.
Okay, awesome, awesome. And so, how do some of the community health workers collaborate with like local healthcare providers and other
Mhm.
agencies? So, do you all go to different events that are held in the community and offer your services and information? Or do you all have different people come to your facility,
Okay.
that offer different services to your clients?
Okay. So primarily, they go out to different events. So they can be health fairs,
Okay.
or a lot of times we create partnerships with different organizations, such as like I said, those food banks in
Mhm.
those health facilities. They actually go there, and they may be there for half a day, and they're seeing patients and clients. So that's how we're providing the service. So we're actually out in the community at those locations, and we create partnerships. So based on what that organization need, they can refer individuals to us, and also there are organizations that we find out about, so we refer individuals to them that we cannot handle.
Okay. Okay, awesome. And I did hear you say earlier that you all have a men's division that you
Yes.
all assist in. Can you give us some more information on that?
Yes, so with the men division, I primarily work with a lot of community-based organizations on just increasing men's health, especially minority men's health, because we see
Hmm.
there are a lot of health disparities, around minority men, and a lot of times they don't understand that you have to, in order for you to be here to take care of your family, you got to take care of yourself. So
Yes.
I work with a lot of churches on, like, for example, on prostate, doing education, making sure
Hmm.
men get referral. Also, I take direct referrals, so men that are if there are different men in the community that organizations run into, they can refer them to me, and we'll help them get them into care. So they can be access to care into the Grady Health System. They can be mental health resources. It could be higher education. If they want to, go to school, we help get them a GED. I find the right location for them that's in their area. So we really do have a holistic, approach when we approach our men.
Awesome,
Mhm.
awesome, awesome. Okay. And so one of the just doing my research on the
Mhm.
Fulton DeKalb Hospital Authority, one of the biggest resources I think, which is a hidden gem that I have never seen with another agency, is your EMS scholarship program that you all have. Can you give us more information on that?
Okay, yes. So the EMS scholarship, so that's it's an application system. So individuals in the community, they have to apply, and
Okay.
based off their application, they get a full scholarship to the EMS program with Grady. So we will pay for to tuition, the books, the whole everything they need, we pay for. We kind of work with them along the way. So if they need assistance or not, are not doing so well, we'll intervene, get them whatever services they may need to make sure they pass the course. Because we also know there's a shortage on EMS workers too. So we're trying to make sure we have enough people in the community to be able to be responsive and take care of the people in Fulton and DeKalb counties.
Wow. So
Mhm.
is there anything that would disqualify them being able to receive that scholarship to be a paramedic or EMS or EMT?
Not that I know of. I think it's pretty general and pretty well open. They just
Okay.
have to apply, and then based off the criteria, when they're going through, then it's very competitive, so they have to be selected to get in. But I don't think there's no hard things that will keep someone out.
Awesome. Awesome. And so how many people, if you know this, how
Okay.
many people actually apply and complete this type of program?
Okay. Right now, I think in our last cohort, because we're working on our this current cohort, I think we had over 100 applicants, and we were only able to have I think 15 at the time because of the instructors. There's limited instructors, so it's kind of the need kind of outpaces what we can do. But we had like over 100 applicants, and we were able to place 15 in the program, and all 15 of those individuals passed the program. Yeah.
Wow,
Mhm.
awesome. Okay. So once they pass the program, do they get a streamlined job in order to become a paramedic or emergency medical technician with Grady? Or
Mhm.
are they sourced out for other hospitals that may need their services?
Primarily with Grady, so that's the idea, is get them right into Grady. But
Okay.
if they can't get into Grady, then we work with other health systems to get them employed. But primarily with Grady, so yes.
Oh, that is awesome.
Mhm.
Oh, I'm gonna start telling people about that. Like, y'all need to get in that program. Okay.
Right.
Because that's awesome. I don't, wow. And y'all pay the full tuition and
Hmm.
then line them up with a job immediately after that. Why wouldn't people apply? But you know what? I think that people don't know because I didn't know until I even started looking into what you all do. And I
Right.
found that on the website and I'm like, that's something that the community need to know about. Like you can get you a job. Just get up there
Right. You
and
can.
apply.
You can. If you're motivated, you can get you a job.
Absolutely, absolutely. And so how does your organization measure like its effectiveness of being able to bring education and awareness to the community? Because I feel like I've seen you at multiple
Hmm.
events now. And we are in the same helping
Right.
profession in terms of just helping people with resources. But how do you all measure that you getting out in the community and helping with the resources that you help with is actually being effective?
Okay, so it's primarily data. Data is king. So zip code. So we're able to drill down on the different zip codes in the metro area. And also we're able to use some data from Grady to see what are those hot zones or where those people having issues at. But within that data, we're able to measure the number of referrals that we're doing. So how many people that we're actually linking to care? Who's getting care? Who's getting a referral? What resources are they getting? Also, we're also able to count the number of people educated. So who's getting health education?
Mhm.
Many topics, but who's getting that education? So based off those two metrics, we're able to assess, okay, how effective we are in the community, and then from there we can do a needs assessment as is to see, okay, if this zip code is hot, but I'm not seeing no data over here, so that means we need to look into that and see what's going on. We may need to stretch over to this side a little bit better to make sure we're not missing those individuals in need.
Okay. Okay.
Mhm.
So based off your effectiveness of reaching out and your referrals with the services, have you all had like any success stories that you can remember where you felt like we did what we needed to do and we got this family the services and the resources that they needed?
Hmm. So those are, I'm gonna try to keep it. It's a lot of those. Let's see. I know one success story that another CHW that I managed had. There was a person was having a mental health crisis. So
Hmm.
our CHWs have been trained a lot in a lot of different subject areas, so they know how to handle situations. So she was able, instead of, it was a situation, she was at a senior facility and the senior was having like a moment. So instead of like, she suggested, instead of them calling the police, because that can go many different ways when you call the
Yep.
police. She suggested 988, which is a new number for mental health that
Okay.
you can call, mental health services. And they sent out, they have workers that they send out to help individuals that are having mental health crisis. And once she told me that once the people came out, they were able to calm the individual down, the resident down, and she was able to go back to her room and everything was fine. But they could have went a total different way if a different organization, agency had been called to deal with that. Because a lot of times we
Yep.
see that some agencies are not as trained in different areas as they should be. So
Right.
it's great that we were able to use the knowledge that our CHWs have obtained through the different trainings and educations to able
Mhm.
to de-escalate that situation. So that's one
Wow.
story.
You know what? And that's an awesome story
Hmm.
because just like you just said, you never know what results you're going to get or the outcome that you're going to get if you
Hmm.
contact the police. And it's sad because you should be able to contact the police. They are also a helping professional to assist, but you just at the end of the day, if it comes down to a life or death with that person, you want to reach out to somebody else that
Right.
might be skilled,
Skill, yes,
in
skilled
that.
in that.
Yep.
Hmm.
Yeah.
So that was
Okay.
a great example. I think one more would be, well, we got a lot of calls when we're referring individuals um, in the community. So I'm trying to remember, we had one situation where we had an individual. It was a family, and they were needing like a lot of services. They was a Hispanic family, and they were needing like clothes, I think diapers and food, and we
Mhm.
were able to work with them on getting that. So and then they called us back and they just told us how how thankful they were for the different services, because a lot of times we see there are a lot of resources out here, but a lot of individuals just don't know how to access those
Yes.
resources. Even trying to Google something, I mean, a lot of times that still doesn't work. So having a designated person such as CHW that's well versed in the resources that's in the area, the metro
Hmm.
area, really
Hmm.
does help. And they was able to get the services fast. They was able to get on Snap. I mean, it was a whole list of things that the CHW was able to do, and they were very gracious because that took them to the next level. They feel like they wasn't struggling anymore. Okay, they had help that they needed, so now they can continue to live their life. So that's another success story.
Absolutely. And that is great because that's the reason why I started doing these lives,
Hmm.
because I realized like going out to these different events and seeing, so like that's how I met you, and I had
Right,
never heard of your organization
right.
before. And then when I got like my little community health worker initiative paper that had like some of the services that you did, I'm like, well, where was this when I was working and trying to find people services in Fulton?
Hmm.
And I had never heard of you all. And so I think it's so important to, if you can't get the community, like I said before, to come to you, you got to come out to the community. You
Absolutely.
got to let them know, like, hey, we're here, like we're available to you. We can help you to locate this, we can help you to find that.
Hmm.
And so I'm so glad that y'all help so many people because y'all are needed. Y'all are needed.
Right.
And so do you face any challenges when it comes to being able to help people? Like, is there any red line or red tape
Hmm.
when it comes to being able to do what you need to do for families, or having any apprehension from families with helping them?
I think the biggest issue, which is the issues across the board, is like the funding. A lot of organizations are out here, but they don't have, once clients contact them, they don't have funding. So it
Yep.
kind of sends them on a circle in this loop again of trying to find another organization that has funding. So it really the funny thing in the housing crisis is there's just not enough housing. So individuals are always looking for housing, but there's only again only so much we can do because we really rely on those our partner organizations to provide those services. So if they don't have the housing or the space, all we can do is continue to try to find resources for you, but there's only so much that we can do because of this is the landscape that we're in right now.
Absolutely.
Mhm.
And you know what? I'm in a lot of different groups on Facebook, and that's one of the things that I see. I see is a housing issue. And I also see like a food insecurity where
Mhm.
people are applying for SNAP and they're applying for TANF or different things, and they can't get that communication back from the agency. They've applied, they don't know what's going on. So, yeah, you're definitely right. I do see a lot of that going on in the community as well. And so for people that are looking for your services and that have never heard about you and that know that you all do a referral program, how can they get in contact with you?
So there are multitudes of ways. So they can visit us at fdha.org. That's one way you can contact us, or they can contact me by email. It'll be the letter J, HUSB, AND
Mm-hmm.
at thefdha.org. And that'll be the easiest way to get in contact again with me because a lot of times I have to do we have to do assessments. So I had to do assessments on individuals, and also depending on the county, I had to refer them to the individual that I supervise. So from
Mhm.
there, I'm able to, we're able to talk to them and figure out, okay, exactly what you need, because it's a simple process, but it's not, because when you really have to drill down, okay, what you need, where is it located, so we have to do it. It's more individualized that we have to do. So there are two ways they can reach us.
Okay, awesome, awesome. And before I ask you one of my last questions,
Mhm.
I see we got Aaliyah Howard and we got Aquila McCray. Thank y'all for joining us on our Let's Talk Wednesday today. Ladies, do you all have any questions for Jalen or any questions for me that you need more information on?
I did have two questions, and thank you guys for putting on this. This was
Mhm.
very informative because I had no idea that a lot of these resources was out here. When I seen it on the ad, I was like, "Ooh, immediately, let me tap in and see exactly what's going on and if I can get involved some way." And I'm very much so glad that I came today. And so my first question is, how long is the course for the EMS program?
Um, going off memory here, but I think it's a 3 month course. So
Mm-hmm.
yeah, I think it's 3 months. I had to go back and verify that, but last time I remember it was like 3 months program.
And would you be under a contract with the company after you finish, as far as like, because some companies be like,
Yeah,
okay, we sent you to school for XYZ, you must work for us 3 to 5 years, whatever. Is that a
right.
clause?
No, not a clause. We encourage you to work for, come into the Grady Health Systems and be with us, but you're not under contract saying you have to, but it's strongly encouraged that you do, because you're learning from a Grady EMS, so
Okay, no problem. And I just needed y'all website one more time. I know I got Grace agency for you, Miss Collins, but
okay.
yours was afdha.com.
.org. Let me make
Dot
sure I
org.
get to you right. Yes, it's actually THEFDHA.org.
THE
FDHA.org. I just want to verify. Yep, that's it.
org. Okay.
And then Jalen, I have someone that asked, can you repeat that email, your email
Okay.
address?
It's the letter J, husband. So JHUSBAND at THEFDHA.org.
Yeah, and that was actually my mama asking for that.
But it
So
was okay. Well, I'm glad she got it. I'm glad I was able to give it to her.
uh-huh, uh-huh.
Hello. So, Jalen, by you guys have 100 applicants. Like, is it hard to get in the program? Like, if we was to apply, like, how soon could we get in the program?
That report I don't remember offhand. That part of it, because I don't oversee that program, but I work with the program. But
Okay.
I would say it is competitive. So it is a competitive program, because again, it's open up to the metro area, so it's a lot of people. But I wouldn't say it's too hard. But if you're interested, I would say you should apply, and then just see where it goes. But it is a competitive program.
Okay. Thank you.
Well,
And also, Jalen, is there a specific time period, or can people just apply at any time? And then when they open it up for like classes, or for they open it up for the course, then you'll be notified, like if you get picked and when
mhm.
to start.
Last time I checked, it was an open, so
Okay.
you could apply and they will hold it unless they change something. But last time I checked, that's the process that they had.
Okay. Okay. And is it a long process from what you know where it takes to get approved?
No, so I think they once the cohort starts, they start screening applications, vetting the people, and then I think it was last time I checked, it was like a couple within like a couple of weeks that the person knows that they've been accepted into the program.
Oh, okay.
Mhm.
That's awesome. That is awesome. I'm gonna try to tell as many people as I know about
Right,
this
it's a
program.
great program.
I feel like you don't hear about these type of programs where your tuition is paid and then you get straight forwarded to a job. Like
Right.
typically
hmm
you have to go through like traditional school, like a tech program,
hmm
and then go in, but most people don't want to take that route anymore, and I don't think that that has to be the route for everybody, but I feel like this is a wonderful opportunity. So anybody that is looking to get into the medical field, I'll definitely let them know. But this is question is for you, Jalen.
Okay.
what's your why? What is your passion behind helping people in the community? Because we know that it is an insurmountable amount of people that need help. Like if you open up your doors, everybody and their mama would be in there because everybody's needing some type of help, especially with inflation prices and stuff going on with the housing crisis, rental, and all of that. So what is your why? Because I know it's not easy, to
Mhm.
be there and constantly receive calls, and basically your whole day is filled with people that are in need.
Right. My why would be probably because of just being in the public health field and seeing the disparities and seeing why. I mean, the reason there's a I'll say there's been structural things that have been put in place to keep people at a certain place in life. So
Mm-hmm.
they need these different resources to really help them to do better. I believe in empowerment. I believe everyone can do better, but they just kind of they need to be. Sometimes people just need a little direction, a little help. So
Yep.
I see it. So again, I see it all the time. There are people that are really trying, but they don't have the resource or they just don't know how to do it. So if I'm able to, based off my knowledge, based off my experience, I'm able to help these individuals get the resources they need. I mean, that's important to me. I view my work with a health equity lens. So I try to focus in on my minority populations because I know
Mm-hmm.
they struggle a little bit more with our resources. So just
Mm-hmm.
really my experiences out in the field and really the knowledge that I've gained, through school and seeing those different health disparities, they are real and they do keep individuals from succeeding in life. So me being able to give back with the knowledge that I know and the resources to help someone, I mean, why wouldn't you want to do that?
Absolutely. Absolutely. So really that is all the questions that I
Okay.
have. Jalen, I felt like you really did a great job of talking about the different services that your organization offers, as well as the different departments,
Yes.
and giving us information that we can take out to other people to say, hey, y'all need to watch this live, or hey, look, I'm telling you, this is what they do here at the Fulton-DeKalb Hospital Authority. So thank you so much, Jalen, again, for taking time out to explain to us so that we can get this information back to the community.
Yeah.
Thank you, Aaliyah and Aquila, if I'm saying your name correctly, for joining our live today with your questions. And does anyone have any last parting words before we leave?
No, thank you for this wonderful information.
You're
No problem.
welcome.
And same here. Same here. Thank you guys so much.
You're absolutely welcome. And thank you, Jaden, again, Jalen, for everything. And I will be talking because I'll be
Yes.
sending some people your
Okay.
way, that I know that you'll be able to help that's in that community that you serve.
Okay. Thank you so much. Looking forward to it.
You're welcome, and y'all have a great day.
Okay. You too.
Bye.